Why does bad breath occur? Bad breath in medicine is called halitosis. One of the symptoms of diabetes is halitosis or bad breath. This is due to the fact that high blood sugar levels increase the level of glucose in saliva. Bacteria feed on glucose, causing plaque to build up on the teeth, which can lead to tooth decay and gum disease. Diabetes can lead to unusual, or sweet breath. Diseases such as diabetes can cause an unusual odor. When a person has diabetes, their body either does not produce enough insulin or cannot use insulin effectively. Normally, insulin breaks down glucose for energy. If the body cannot get energy from glucose, it starts burning fat as fuel instead of producing ketones. As ketones accumulate, they increase the acidity of the blood, which can be toxic and cause the smell of acetone on the breath. Poor oral hygiene is a common cause of bad breath. As we consume various foods and drinks throughout the day, they often get stuck between our teeth and lodge in the folds of the tongue and other areas of the mouth. If the accumulation is not removed daily, it leads to bad breath and can also lead to an increased risk of gum disease and tooth decay. Dehydration, taking various medications, skipping meals, drinking coffee, smoking, snoring and alcohol can affect saliva production and cause bad breath. Good oral hygiene can minimize bad breath. Brushing twice a day, cleaning between teeth and using a tongue cleaner scraper can help, along with regular dental visits.